care of you today. Can you tell me your name and date of birth, please?
Newcomer 32495.
Great. Can you tell me where you are?
Kansas City.
Can you tell me why you're here?
Just check up.
Can you tell me what day it is?
Sunday.
Great. Patient is alert and oriented ×4 with normal phonation. He's speaking in his native tongue of English and he's well articulated. His posture is a little bit rounded, but he is turning his body towards me and looking at me when he speaks. So I would say posture is normal for his age. Are you having any pain today? Great. I saw that your vital signs, your blood pressure was 110/70, your heart rate was 60, your temperature was 96.5, your respirations were 16, and your oxygen saturation was 98%, which are all great. Do you have any questions before we get started? Okay. I'm going to go ahead and assess your hand here. His skin is pink, warm, moist, and soft. No scarring, lesions, edema, bruising, or nevi noted. His skin turgor is healthy, no tinting. The warmth, his upper extremities are warm bilaterally. His radial pulses are intact at 2+ bilaterally, and his cap refill on his upper extremities is under 2 seconds, which is wonderful. Now I'm going to move on to your head. Do you have any tenderness here?
No.
Okay. I don't see any infestations, no masses, bulging, or nevi noted. This is great. His hair is filled in well with no dry patches or patches without hair noted. His skin on his face is warm, pink, moist, and soft. He does have some healing acne, which is appropriate for his age, and some facial hair that's coming in, which is also appropriate for his age. Can you smile? Great. Symmetric facial expansion. Now I'm going to go ahead and test your eyes. Can you follow my pin? Great. 6 cardinal fields of gaze are all intact, no nystagmus or concerning findings found. Now I'm going to test your pupillary reflex. Just look towards me. Great. Pupils are equal rounding reactive at 3 millimeters. Now I'm going to go ahead and palpate your lymph nodes. Please tell me if any of these are tender. Pre-auricle, post-auricle, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Any of those? No. Great. None of them were enlarged or warmth to the touch, so no concern findings. Now I'm going to go ahead and test cranial nerve 5 by palpating your masseter muscle. Can you clench your jaw? Great. Any pain there?
No.
Can you open and close your jaw? Great. No crepitus or subluxation felt. Do you have any tenderness there?
No.
Okay, so TMJ is negative. I'm going to go ahead and palpate or check for sensory function of your cranial nerve 5. Tell me when you can feel my finger on your face.
Yep.
Great, all is intact. I'm going to check for cranial nerve 7. I'm going to have you do some faces that I'm doing. So can you smile, frown, puff out your cheeks, pout your lips, and then raise your eyebrows? Great, that's all intact. Now I'm going to look inside your mouth with my pen light. Say ah. Great, buccal mucosa is pink and no lesions noted. It is moist, no dehydration concerns. All of his teeth are coming in, they're white and healthy. Can you stick out your tongue? Great, it is symmetrical in midline tongue expansion. Then can you say ah? Great. So, his soft palate and uvula rise symmetric with phonation, which checks for cranial nerve 12, and that is great. And his tonsils were 1+. Next, I'm going to move on to testing your range of motion of your neck. After I palpate this, so I'm going to feel for your trachea here, and it is midline. I don't see any masses, lesions, or concerning findings here. His skin is pink, warm, moist, and soft with no edema. I'm going to go ahead and palpate your thyroid gland. Can you go ahead and swallow? Great. It is not enlarged with no lumps or bruising or anything that is concerning. I'm going to palpate your carotid pulse. Great. No, no pulsations felt. I'm going to listen over your carotid pulse. Okay. No bruise, hurt, or abnormal findings. Now, can you flex your neck, please? Great. Can you extend your neck and hyperextend your neck? Great. And then put your ear towards this shoulder. Okay. Turn towards that. And then turn your head towards your shoulder. There you go. Great. Full range of motion of your neck. Moving on, I'm going to test your upper extremity, your range of motion for your upper extremity. Can you flex and extend? Great. And behind you and in front of you. Great. And then do a little circle. Beautiful. No restricted range of motion. I'm going to go ahead and listen to your 5 heart sounds. Okay, I'm going to listen to them with the bell of my stethoscope. Great. No murmurs appreciated. Now I'm going to go ahead and listen to your lung sounds. Okay, symmetric expansion of his lungs in the front and from the back. Now I'm going to go ahead and listen to your posterior lung sounds. Okay, I'm going to go ahead and have you lay down so I can assess your abdomen. So abdomen presents symmetrically. There's no pulsation. His umbilicus is intact and midline to his abdomen. There's no distension, no edema noted, no lesions or bruising of concern. Like I said, his abdomen is flat. His skin is pink, warm, moist, and soft. I'm going to go ahead and listen to all 4 bowel sounds. Great. Positive bowel sounds in all quadrants. I'm going to go ahead and listen over your aorta, extending into your abdomen, noting any vascular sounds. None heard. Now I'm going to lightly palpate your abdomen. Any tenderness or pain? Okay. I'm going to have you sit up. I'm going to test your lower extremities. So lower extremities are warm to the touch bilaterally. His skin is pink, warm, moist, and soft with no bruising, lesions, edema noted. Lower extremity pulses are 2+ bilaterally with cap refill under 2 seconds, which is great. Now I'm going to check your range of motion on your legs. So can you extend? Great, and then can you flex? Okay, and then pull up against my hands and push. Great. So 5+ full strength on his lowers. And then test your hand grasp. Okay, great. And raise your hands against mine and push. Great. So full strength on upper and lower extremities. Now I'm going to have you stand up so I can check your back for scoliosis. So turn towards the window, please. There you go. Now reach towards your toes. So I'm going to assess the spine and note that it is symmetric and midline throughout his back with no curvature noted. Now I'm going to assess your gait, so can you walk to that side of the carpet, please? Wonderful. No off balance or ataxia noted. It was a normal gait. Then can you walk tandemly, heel toe to this side? Wonderful. No off balance or any abnormalities noted. Can you hop on one foot, please? Great. And then your other foot? Wonderful. That all seems intact. Now I'm going to tell you that our next checkup is in 6 months, where you get your flu, MMR, and Tdap vaccinations. Do you have any concerns with school or feeling down or hopeless or lost?
No.
Okay. Do you feel like you have a support system at home?
Yes.
You make good friends?
Yeah.
Great. And you go to the dentist twice a year?
Yeah.
Great. Sounds good. I will see you at our next checkup.